Hello everyone, this is Joe here and welcome to my presentation on sensory stimulation programs in occupational therapy, also known as coma stimulation or SSPs for short. And the purpose of this presentation is really twofold. First off, just to provide a brief overview of sensory stimulation programs, but then also too I'd like to specifically highlight some of the key points that I came across within my readings and the research literature. And then the second focus, and probably the most important, is to really answer that question of why are sensory stimulation programs important? Why is it important to know about them? And how can we justify and provide rationale to either a rehab manager or also to an insurer as to why these are effective, safe, and tolerable? So, sensory stimulation programs really have two main goals. The first goal is to counteract chronic immobility, and then also to prevention of other conditions that could result from chronic immobility. This part of the program is really focused on more movement stimulation, and then also to positional stimulation that's associated with more traditional forms of rehab therapy, such as range of motion, gentle passive stretching, positioning at the edge of bed within a more natural position for responses to other aspects of stimuli such as visual, auditory, etc. And this also too may include therapies such as functional orthotic devices, a resting hand orthotic or other positional orthotics to prevent contractures that may have developed or could be developing from flexion synergy patterns or abnormal posturing that's developed throughout the recovery process. So these individuals are in the bed for a significant portion of time, and therefore that takes its toll, and we definitely need to be cautious and aware of that and trying to prevent worsening of any conditions and then to help them the best that we can. So, and then the second goal of sensory stimulation programs is to facilitate decreased time for an individual to come out of the coma, or decrease time to both arousal and self-awareness. So, and this is engaged and conducted by really targeting all of the senses. So not only including movement, positional stimulation as I just mentioned, but also too including other aspects of the senses such as visual stimulation, auditory stimulation, olfactory stimulation, tactile stimulation, etc., etc. So those are really the two main goals of sensory stimulation programs. These programs have been around since the 1980s, and currently right now they are actually considered investigational and not medically necessary. And the primary reason for that is because there's a lack of randomized controlled trials for these particular interventions. There are RCT studies that are available out there, and however too there are studies that have shown significant improvements for individuals who've been within the experimental sensory stimulation group and have really emerged I guess more frequently from the coma or quicker from the coma, and then that also have demonstrated good results in comparison to controls as well. There have been some studies too that have shown no difference between experimental group and control group. So with that being said though, the fact that there have been significant results from studies, I think it deserves our attention in regards to learning more about them. So sensory stimulation programs would primarily be designed by a rehab professional. Typical protocol would call for anywhere between 2 to 5 sessions per day, probably 5 to 7 days per week for 15 to 30 minutes in duration. Very, very key to monitor all responses from the client, such as basic vital signs, blood pressure, heart rate, respiration, and how those change and fluctuation. To individuals who've received the stimulation, for some individuals we might want to, or our aim might be to facilitate more inhibitory responses, and then others to facilitate more stimulatory responses of those basic vitals. The program developed by the rehab professional is going to be structured, organized, and really have key points to it that can create a schedule for the patient that all rehab staff, all support staff, and even family members can adhere to. And this isn't just for adherence of the actual treatment protocol, it's to maximize optimal healing of an individual who's experienced severe trauma and needs a really controlled environment for their brain to optimally heal. So there are more complex components of sensory stimulation programs, such as monitoring for meaningful responses elicited by stimuli to the patient. This was one thing that was reiterated in the literature, and that it's really important to be able to distinguish a meaningful response as opposed to just an unintentional reflexive response from the patient. And that's where our standardized measurement scales, such as the JFK Coma Scale Revised, our Ranchos Los Amigos levels of cognitive functioning, or Glasgow Coma Scale, are really essential from a therapeutic standpoint as far as addressing and assessing progress throughout therapy, and then also to responses to various stimulation provided within the treatment plans. There are other aspects of sensory stimulation programs that may be less skilled, and this can be very, very helpful from a standpoint that we can get family involved with therapy. That's actually encouraged. There's been research that's demonstrated that familiar voices, so the auditory stimulation, has demonstrated improvements in arousal states and also to meaningful responses in rehab. But then also too from support staff as well, trying to get them involved. So we'd want to create a program and a protocol that's specific, tries to really maximize the control of the environment that the patient is in. For instance, not leaving the TV on all day in the room, trying to minimize background noise, have only one individual talk to the patient at a time, really try and keep it focused and controlled, so whatever stimulation that is provided, it is not overstimulating or habituating the patient, so then therefore they can maximally respond to that. There's lots that go into sensory stimulation programs. Definitely a lot of knowledge that has to be learned in regards to assessing progress, and then also to design, and then also to gauging progress with treatment goals, etc. Getting everybody on board as far as education is concerned. OT is very well suited for sensory stimulation programs because of that sensory processing integration component. Fits perfectly within the occupational therapy practice framework, and it also too contains and incorporates more traditional aspects of therapy too that we would commonly refer to with somebody who would be in this state that would receive anyway, such as the positional and movement therapy, etc. So why is it important to learn about sensory stimulation programs? I did not know much about these programs until some of my fieldwork experiences, and then also too reading within the research. But very, very important from a clinical standpoint, I think, to understand these, because there are very few programs or facilities within the area, within the local Michigan area, etc., that offer specialized care for somebody who's in a low state, emerging from consciousness, etc. And with that being said, if it may not be uncommon for an individual to find themselves at a subacute rehab facility, and now being required to treat an individual who is just emerging from a minimally conscious state, and to be able to provide a level of organized, skilled care, I believe is really important for client healing, optimal healing. From a reimbursement standpoint, these integrate other aspects of therapy as well, such as the movement and positioning, that I think are very applicable to general, more traditional rehab as well. So from that standpoint, and evidence within the research suggesting significant improvements in comparison to controls for these SSP protocols, that it's definitely worth the attention of learning about and being aware of, and determining the situation that this might be applicable to.